Hello and a very warm welcome to this, our fourth Wednesday webinar of 2021. You're joining us by Zoom. It's great to have you with us. When we left last time a fortnight ago, I was full of hope. The days were getting longer, the days were getting warmer. Since then, the days have got colder and badminton has been cancelled. But fear not, in 3.5 weeks, the clocks will change and the days will get even longer. So there's plenty to look forward to, and I hope you're doing really well. So you're joining us by Zoom, and by doing so you'll be able to take part in our couple of poll questions that we've got for you this evening. And we're just going to wait one moment until people join us on Facebook Live before we get going proper. As I say, this is the fourth one of our Wednesday webinars for this year. We've been running them since last June, and if you've got any suggestions for future webinars, then please do keep sending them through to education@worldhorsewelfare.org. And a very warm welcome to those of us who are joining by Facebook Live. It's great to have you with us for what is our fourth Wednesday webinar of 2021. And tonight we are delighted to have two speakers: Chris Tufnell, a trustee of World Horse Welfare, highly experienced vet who runs a very successful practice based down in Newbury, and also the newly promoted Deputy Chief Field Officer, Jon Phipps. Tonight's discussion is around equine first aid, and we want this very much to be a two-way conversation. So please do, if you're joining us by Facebook Live, then share the video. If you enjoy tonight, then please do take a look at tonight's, but also the previous Wednesday webinars that which are all recorded on our YouTube channel. And we want tonight to be very interactive. So we have two presentations. Chris is going to talk for a longer time, and then a shorter presentation from Jon, and then we'll have chance for Q&A. So if you've got any questions now, or as you hear the presentations, then please, if you're on Facebook Live, use the comment section, and if you're on Zoom, then please use the Q&A function. By all means, use the chat function to chat amongst yourselves, but please use the Q&A function for question. And I would say, if there's questions on the Q&A that you really like and we're going to ask, then please just upvote them. There's a facility on the Q&A function just to upvote, and then they'll rise to the top of the list, and hopefully it'll be more likely that I will see them. And I was just saying to our Zoom followers, if you have ideas about what we might do for future webinars, then please do send them through to education@worldhorsewelfare.org. And in 2 weeks' time, on the 17th of March, our next webinar is going to be buying a horse, traps for the unwary, and we've got a link for registering for that. So I'm now going to share my screen, and before I introduce Chris, I just wanted to there we go. I've picked on the wrong one, but I'll get there in the end. I just wanted to ask a very quick poll question. So apologies, some of the photos you'll see this evening are fairly graphic, including this one, but I can assure you this one, horse made a very successful recovery. But have you been trained in first aid for humans? Obviously, some of us have done, and it's a very simple yes or no. It's just to give us a feel for who's joining us this evening. And now, before I introduce Chris, and whilst you're answering that question, I just wanted to say a very little bit about World Horse Welfare. So if you joined us before, as I said before, you can probably do this better than me, but World Horse Welfare was founded in 1927. And at the heart of what World Horse Welfare is all about is to support the horse-human partnership in all of its guises. And obviously horses from a UK and a British perspective and many parts of the world are used in sport and leisure, but also across the world they're also utilised for farming purpose, as working purposes as well, but also in areas like therapy and a growing number of other areas too. Currently, World Horse Welfare is working across the world in 16 countries outside Europe, and we run the largest in Britain. We run the largest rescue and rehoming scheme in the country. And I'm delighted to say last year, 2020, despite the pandemic, we rehomed over 350 horses. So if you are thinking of getting another horse or pony, or want a companion for one you already have, then please do take a look on the World Horse Welfare website. Now, education is at the heart of what World Horse Welfare does and works in partnership with so many other organisations to improve our understanding collectively, to make us better horse owners. And I think for all of us who own horses, that's what we want to be. We just want to be better horse owners. And I really hope tonight's webinar is going to help us do just that, because these are to support us as owners, and tonight is on equine first aid. And what we really want to help everyone is to give ourselves a better understanding of what to do in an emergency situation, what not to do, and how to keep ourselves and those around us at the time in an emergency situation safe. And so it's before finally I do introduce Chris. Basil, could you just give us the results of the poll question? So there you go. Over two-thirds of those joining us tonight are have been trained in human first aid, and a third have not. But whether you have or haven't, I really hope tonight is going to help you in those situations, should you have them, where you have an emergency with your horse. So finally, I seem to have stopped sharing my screen. Finally, I can introduce you to Chris, who, as I said at the beginning, is a trustee of World Horse Welfare, and has had a rich and amazing career in the veterinary world, including being past president of the Royal College of Veterinary Surgeons. But a couple of things you might not know about him is he, for a year before, I think before being a vet, he ran a safari camp in Zambia. He also surgically removed a human toe, I think whilst out in Africa. So there you go. You're desperate to go on holiday. Chris can help you. He can also provide you with first aid whilst you're on holiday. You could not have a better chap to give us a talk on equine first aid. So Chris, I will stop my screen sharing and hand the floor to you.
Great, thank you very much indeed, Roly. I'm going to go straight on to sharing my screen. And yes, welcome to everybody from all over the world, I gather, which is delightful. I'm going to particularly welcome those people north of the border, my cousins Flora and Gracie on the Isle of Mull, and Katrina just north of the border, mainly because it's fascinating how when I'm on holiday up there, they never listen to a word I say, but they seem to want to tune in this evening to listen to what I've got to say now. So I'm delighted that they're joining us, and all the rest of you from all over the world. So what are we going to learn this evening? We're going to focus very heavily on equine wounds and what to do in the initial moments that you discover a wound. That won't obviously be necessarily immediately after it's happened, but the first things to do with equine wounds. And one of the most important things that I want you to take home from this evening is to do no harm. It's incredibly easy to damage tissues. And these little skin cells on the right-hand side of this slide, particularly if they're new skin cells trying to form and cover in a wound, are very delicate. You can't see them by the naked eye, but they are delicate, and they're easily damaged by all sorts of things that people do to wounds in error. So there is no one way to do anything. So I'm sure people will find that the way I'm going to suggest you do things is not necessarily the way they do it, and that it's worked for them for many years, and that's fine. And I'm really happy to have discussion with you in the Q&A. But I'm not going to profess that my way's the best way or the only way of doing things. But I hope that in stressing that we can keep things simple, you'll find that you do no harm. There are those of us that are really lucky and stay quite calm when things are hitting the fan. And there are those of us that aren't so good at it. And some people who aren't so good at it know they're not very good at it. At the times when you're trying to deal with an animal that is frightened, probably in pain, and has a wound that needs dealing with, it's best that you keep out of the way if you're one of the people who isn't very good at dealing with these moments. We all know that you're concerned about your animal, but the best way to help it at these moments is to let those that are able to stay calm and deal with the situation deal with it. I know that's difficult. Now, the equine world's not short of opinions, and we're all entitled to our opinions, but we're not entitled to our own facts. And we feel very strongly as vets, and certainly in my practice, that we are part of a team working with you and others to look after the care of your horses. But please, if you've been given a lot of opinions from various people around you, please do consult your vet. For reasons that I'll come to later in the talk, you'll find that there are a number of things that you might have thought weren't going to be a major problem for you, and yet they could be. So do consult us. You can consult us very easily these days with video phones or just photos by text, and we can tell you over the phone whether something is a concern and needs seeing. And as Rowley said, it's so important to stay safe in these situations. Animals are frequently frightened, frequently in pain, and can act unpredictably, even the ones that you know really well. Now, we're learning a lot more about PPE, obviously, with the pandemic, but the equine world's not always the best at PPE. And you will see on a lot of the videos and things from World Horse Welfare that the handlers are wearing hard hats, they're wearing gloves, and they're almost certainly wearing steel toe capped or reinforced boots or shoes. I'm not a shareholder, but I wear Equitector boots, which have got a steel toe cap in them, and they're really, really helpful. And it's so easy to lose the skin on your hand or have a nasty bash to a foot or a head, more importantly. So please do stay safe in these situations. And it's the first bit of assessment to do if you have an injured horse, is to look at things that could potentially cause you harm, or more importantly, it's sometimes easier to see where others are putting themselves at risk, and people do. And if you do, please speak up and help them keep themselves safe. So we're going to look at what you do to assess the situation right at the start, and I'm going to run through these three main things to look out for. Bleeding obviously being the most important to start off with. Now, I was thinking about the audience and thinking, what was something really critical that you'd be very, very concerned about leaking away? So the left-hand side of the picture is for the teenagers, who would be, I'm sure, hugely concerned if their battery got to this level. And the right-hand side is for people who are maybe a little bit older. If the stuff that's really important to you leaking away, stop it leaking away. Now, bleeding in horses, a little goes a long way. So it can look awfully messy, and it can look like you've lost a lot of blood, and actually they can cope with a fair amount of blood loss. And we're not really worried about drip, drip, drip. That is expected when you've made a hole in something. But when it's gushing or pumping or squirting past your ear, then it needs stopping. Now, as Rowley warned earlier, some of these things are fairly graphic. So if you've signed up for the blindfolded motorbike maintenance course or underwater flower arranging, you're in the wrong webinar, and I would leave now. If you're eating your crisps or peanuts or your supper, then you might discover that it wasn't the best idea to start them before the webinar. There are some graphic pictures because it's impossible to illustrate what we're doing without showing them to you. What I can tell you, except for the two horses from the Gambia, which I don't know the outcome of, all the horses I'm going to show you had a good outcome, just like Rowley's, and did very well. So the first thing to do, if you've got blood gushing everywhere, is stick some pressure on it. And you may be able to see the vessel in the wound. And if you just grab it and hold it with your fist, you'll stop the bleeding. This horse had a bleeder. It had slipped off the ramp whilst being loaded and had dug the edge of the ramp deeply in underneath its fetlock. And when I took my thumb off here, it was like a gushing tap. There was no pumping involved. It was just gushing blood out onto the floor. So my thumb is stopping the bleeding here. And we went on to tie off the blood vessel, and the horse has done really, really well. It's absolutely fine, but it was very dramatic. And this horse did actually lose enough blood to concern me a little bit, but he was a big guy, and he recovered very well without any problem. Once you've got a bit of pressure on it, you can put bandages on it or any fabric you've got to hand and stick a huge thumping great hand on it and press, and then you can stick bandages over that. But what you mustn't do, and this is a really important thing to remember, is take it off to see if the bleeding has stopped. Anytime you've got the temptation to do that, and I know there's a hard temptation to do that because I get it as well, don't do it. Just stick more bandaging on the outside if the blood's leaking through, and the more layers you put on, actually the more pressure you can put on. And except for very, very rare cases where the animal has lost the ability to clot, the blood will clot and stop the bleeding. So please don't check it. Now, you've always got some fabric to hand. The usefulness of that fabric, and indeed the cleanliness of that fabric, might be in doubt. But there is always something, and if you're out and about and your horse has trodden on a flint or slipped on and stuck something into its leg and is bleeding, if you disappear behind your friend or the horse or a hedge and whip off the surface layer of clothing which is likely to be grubby and take off a shirt or something, you've always got some fabric that you can either strip into bandages or you can fold up and put as hard pressure onto a wound. You may even find a friend with a pint and you can borrow his vest. This is the wound that I had my thumb in, just to show you. I've got a few pictures of sort of after wounds. This is actually during the healing, and I was finding my dental mirror a very handy way to stay safe and examine a wound under the fetlock of a hind limb of a horse. The next thing to think about in wounds is foreign bodies. Now, a foreign body is anything that shouldn't really be there. So anything that isn't a bit of that horse. Now, it's very important that we think about the types of foreign bodies. Now, little bits of grit and sand and dust and grass and dirt, absolutely we want to get them out. What we're talking about is foreign bodies that are stuck in the horse and are sticking out. Please, please, please don't move them, and we'll explain the two reasons why we don't want to move those straight away. I hope you'll remember it, because if you're anything like my wife and you see something like this in your cereal, you won't want to move anything, because if you walk away from it, you won't know where it is when you come back. So it's critical you find somebody else to remove this particular foreign body, but the important thing is you want to know the location of it. So Buddy, only a few weeks ago actually, was out walking through deep mud. Now we're often aware, just before it dried up recently, the mud gets really, really soft, and actually we see quite a lot of problems at that time, because when they go right the way through to the bottom of the mud, they're treading on gravel and hardcore and everything, and poor Buddy stuck this ring bolt into the bottom of his foot. Buddy's owner did the right thing and didn't pull it out. But the two reasons that I'm really interested in, one is I want to know where that foreign body has got to. And with the x-rays, and we took more than this one, but I was able to tell whether it had actually got to the bone or not. I can actually tell you, although it looks like it has on this x-ray, it hadn't, because the way the bone arches over the bottom of the foot, with my other view from the back, I could see that it hadn't quite reached the bone. And actually he did really well. We took it out, unscrewed it in fact, and cleaned it up and flushed it as we're coming to, and he did really well. When you're leaving a foreign body in like this, actually Buddy was very happy to have his foot off the floor for the few minutes it took me to get there. But when you're leaving a foreign body in, you do not want to push it further in, and you certainly don't want to be pulling it out. So what do? Well, you take that bit of clothing I was talking about, in this case, my finely ironed shirt, and make yourself a donut bandage. So you'll see my penknife in the middle of this shirt wrapped around it, and you can make quite a big donut bandage and stick it round the foreign body, and then stick a bandage over that, and it won't push it in, and it'll protect it and keep it from causing further damage to the horse. But the other reason we don't want to pull it out is because sometimes these foreign bodies have gone in and have penetrated an artery or a vein, and if you pull them out, you'll get copious amounts of blood. So they may be the only thing that's stopping the wound bleeding, which is another good reason for leaving them in place. Now, I'm not going to talk a lot about fractures because we're talking principally about wounds, but obviously some fractures involve wounds as well. What I would remember is that about 95 or plus % horses that are non-weight bearing and you find in the field will have an infection in the foot and won't have a fracture. So please don't panic every time you see a non-weight bearing lameness, but do take into account that the animal might have a fracture. And if they are non-weight bearing lame, or if you know they've got a fracture, then don't move them. We can always find a way of getting to them and helping them. And do remember that some fractures are eminently repairable. And some of the most dramatic looking fractures, this horse had decided it was, well, it frequently played with the ring bolt on the outside of its door. And on this particular occasion had trapped one of its teeth in it and then panicked and had broken his jaw and put this nasty wound into the bottom of his jaw. But as you can see, immediately after it had been repaired with wiring on the right, it came together really very well, and he's done terrifically well. He was competing within 6 weeks of this injury, and they really do very well indeed. So some fractures are eminently repairable. This is a horse in the Gambia. Now, before one gets critical about the condition of the horse, you always have to remember when dealing with horses abroad and in different cultures that there are quite often cultural reasons why they don't want to put animals down in situations that we would have put them down. And also do consider very carefully the condition that the people are having to live in before criticizing some of the provisions that they have made for their animals. I wouldn't recommend this. This horse was splinted, and actually, having seen a couple of horses that were treated similarly in India, it may well knit if it hasn't got infection in there. But we wouldn't do that in this country, of course, because of the pain that it would have had to have gone through in the interim. But no, some horses fractures are repairable, so it's not always the end of the day for them. This is some of the nicer days, as you can see from behind my picture, and from here I'm very lucky to work in Hampshire, Berkshire, Oxfordshire and Wiltshire, and this is North Hampshire on a particularly nice day last summer. A brief word about small wounds. It's often tempting with small wounds to think that there's nothing to worry about and you're not going to concern yourself about them too much. These wounds, as you can see, the one on the right being over the top of the fetlock and the one on the left being over the top of the hock, are on joints. And these can actually be more concerning than any other wound at all. And why are we concerned about these? Well, this schematic is of a horse's knee, the carpus, and the bits that are in green over the front of the joint and the side of the joint, you can see, are tendon sheaths. Now, these are slippery bags of fluid that allow the tendons to move freely over the joint. But they're synovial structures, so there's no blood in there. There's this synovial fluid, which is very slippery and when working well, allows free movement. And the same with the blue structures, which are obviously the joint capsule itself. In the knee, 3 levels of joint capsule you can see here. Now, if you get infection in these, that can be very serious because the infection leads to adhesions. The whole thing can glue itself together and restrict movement. And as we know, we hope that all our horses, pretty much all our horses, are athletes of a sort, even if they're just used for hacking, and we want them to stay sound. Now, you mustn't panic if you see something over a joint, because you've got about 24 hours or so in which we can treat these and get them flushed potentially and get them sorted out. But please don't ring me a week later and say your horse is very, very lame and you weren't that worried about that little wound over its joint, because actually it could have been the most serious thing. We never know quite how deeply those wounds have gone, and they can be very concerning. And this is a poor horse again overseas. This is in the Gambia again, that has a chronically infected fetlock joint. And apart from anything else, the pain that that joint must be causing that horse. And I'm afraid to say that it's irretrievable when you get to this stage, unless you did some sort of surgery to fuse the joint together, but it's never going to work satisfactorily as a joint again. So well worth thinking about those little wounds. And as I said, you know, sending us a picture and chatting to us before you do anything else. And a quick word on bute or anything similar that you might have to hand. Please, please, please don't give it to the horse. We all want the horse to be out of pain, but it can make investigating the wound and investigating how severe the wound is very much more complicated if the horse has had pain relief before it's fully assessed. So please don't keep bute anywhere near your first aid kit. A first aid kit should be for first aid and not subsequent treatment. Another thing about wounds over joints, this is more about management of them, but we're going to come to what you should do with these situations. But actually, an awful lot of them I do close, and some people don't, but I use the skin that's in a flap as a biological bandage to cover everything over. The biggest problem that we have with wounds over joints, amongst other things, is the movement, obviously, of the joint. And if you don't treat them satisfactorily, you can end up with these chronic granulation tissue situations like this fetlock on the right-hand side, which is an irritating, friable material that every time it bashes it, it bleeds. It's not the end of the world, but it's just not very easy to deal with. And this one I learned a lot of lessons from, because I tried very hard to make it better. And then over the course of 4 months, I managed to return it to looking almost exactly as it does there. So this is what we say. The solution to pollution is dilution. So the first thing to do when you've satisfied yourself that you've not got a foreign body that you're concerned about, there isn't a fracture, and you've got the bleeding under control, is to flush it. And nobody's going to criticize you for flushing the wound really carefully. Little dabs with cotton wool really won't cut it. However, you'll get some wounds that are really obviously contaminated. They've got mud and dirt and everything in them, and obviously washing them out is important. But any wound that's been caused by anything other than a sharp scalpel when it's been sterilized is going to have contaminated the wound with bacteria probably, and you can flush a lot of those out by flushing it with a hose. And I really won't mind if you've been doing that for all the time that you're waiting for me to get to you. So the only real reason that I can think of not flushing a wound with a hose is if the water's not coming out again. The wound on the left, we actually brought into the surgery. Now, if you forget everything else from this talk, please remember this, that the sooner you clean the wound and the better job you do, the shorter the healing period will be. There's nothing that more of an enemy to healing than bacteria and dirt. And getting that out at the start really makes a huge difference. This wound was flushed at home. It was then brought in so that we could tidy it up. It did really well. This wound on the right-hand side, it's a little bit down the road now. The top bit's not looking quite so healthy yet, but the bottom sort of 3/4 has got a lovely salmon pink skin edge, which is starting to cross over, and a healthy granulation bed starting to form then. So you hear us talking about granulation tissue. It's only called granulation. It's got granulation tissue because of what it looks like down the microscope, really, but it's the freshest, newest sort of tissue. We're all heard about proud flesh, and that's not really for this webinar, but the granulation tissue doesn't have any nerve supply either. So you will see us doing all sorts of things to granulation tissue quite happily. But what we're really keen to get is a nice, healthy granulation bed. And as you can see, although there was a significant scar on this horse, it went back to full athletic activity. So did really well. Larger wounds, the more grotty type, this one on the left, for instance, caused by a staking injury. This is the sort that if you stuck the hose pipe in there and there'd been significant damage, you might not find the waters coming out. So do be careful on those ones. But they look horrid. They look really dramatic. But actually, very often they do really very, very well indeed, and very quickly. So however dramatic they're looking, if they're up on the trunk or they were overlying muscles, they're actually going to heal probably better than the ones lower down the leg. But same treatment, get them flushed, get as much filth out of them as possible while you're waiting for us to come along. And the one on the right particularly, probably not the one on the left because it's quite a deep hole of a wound. I would have done the sort of biological bandage bit that I was talking about. So it looked really horrid, this wound on the forearm of this horse, but the skin came together very neatly. And so once it had been cleaned, I was able to keep it clean by putting the skin flaps across. Now, it actually broke down. Now, what breaking down is in terms of a wound is it bursting open again, in partially usually. But by the time it does, it's often formed a granulation bed underneath it, and it's often got smaller by a thing called contraction, where the wound's actually contracting down and getting smaller. So using the skin as a bandage in a place which is really difficult to bandage is not a bad idea in a very fresh wound, and that's what we did. But again, this benefited heavily from having a hose down it. You'll see the little white bit on the bottom right hand side of the wound. That's a drain, which is allowing excess fluid from underneath the skin to drain out. Now, this is where I'm going to get really contentious, because I'm sure all of you have got fantastic potions and lotions and everything and things that you love sticking in wounds. Please don't contaminate the wound. This, I have to say, was a record breaker. I found it on the side in in someone's shed, and they were very happy for me to take pictures. It's got the hair from about 15 horses inside it. Thankfully, I hope this one is usually just applied to keep midges off things and not applied into wounds. But there is a right time to put various things into a wound. For instance, something like honey can be incredibly useful in a contaminated wound or a wound that's got a lot of dead tissue in it. But it's not the fix-all. It's not something that you need to apply to a fresh wound and all the way through to the end. And there are lots of other products like that. So there are products to use at various times during the healing, but a fresh wound does really not need something from the back of the cupboard stuffed in it. Those little cells that are trying to sort the problem out won't appreciate more contamination. So please don't stick something in them. I'm a huge fan of salt water. Hibiscrub or iodine products, if you're diluting Hibiscrub to a dilution that tissue can cope with, you're putting 10 mils of it in half a bucket of water. That means you can barely tell it's pink, and that would not be toxic to the cells. But most people use Hibiscrub with a great big dollop into a small bowl of water, and actually then they congratulate themselves because of the gunk that's coming off the wound subsequently. And actually the gunk that's coming off the wound are the cells that you killed at the last time you cleaned it. So salt water, fairly old-fashioned, but very, very easy to find, easy to use, and a teaspoon of salt in a pint of water. And I don't know the metric calculation, but let's say 2 teaspoons in a litre, and you're not going to poison anything, and a really useful way of cleaning a wound that you're struggling to hose. Competitions are particularly difficult because it's very difficult to find a hose, but if you can take some fresh water yourself and really get these wounds cleaned before you get them home, then that can be very helpful. Now, my first aid kit that I'm going to quickly run through when we, in about 5 minutes time, when we get towards the end, is very, very simple. But hydrogels, which are literally gel and starch to a greater degree, are brilliant things to stick in a wound, fresh wound, if you're bandaging it up while you're waiting for us to come. They come in these sort of little packets which are individual use, and so they're sterile. They actually have an advantage in that some of them, essentially some of the bacteria can actually adhere to the hydrogels, so they can actually help us with cleaning the wound out if you stick them in the wound, and they keep the wound nice and moist. It's an old wives' tale that we need to dry wounds. It was a very sensible thing to do before antibiotics, when gangrene was a huge risk. Actually, we've learnt since the 60s, although you wouldn't know it, that wounds are best kept moist. It's hardly a surprise. We have skin to keep the rest of us moist, and when the skin has a hole in it, it makes no sense to dry it out to expect it to heal. So wounds are best kept moist, and these hydrogels do the job really, really well. I'm going to quickly whip through some wounds on the head, because again, if you're a panicker, these are the ones that really make you panic. And actually, they can very often be nothing to worry about. Horses' heads heal incredibly well and actually very quickly, which is great. This one did really well. It was down to the bone. That little white line you can see deep in the wound is actually the bone. Horses have a wonderful array of air spaces between the outside world and their brain, so it takes a long time to get anywhere near the brain. And this was nothing to worry about. This one did really well. This is pretty gruesome. I accept that. This racehorse had been on the horse walker, decided very soon after it had been put on the horse walker, it didn't like it very much and wanted out, and decided to leave its ear behind on the fence of the horse walker. But looks horrid, but came together incredibly well. And as you can see from the picture on the right-hand side, nothing to concern us with. Now, this racehorse may have been a little bit peed off if you'd approached it with a hose and started trying to hose that ear, apart from the fact you would have filled its ear with water. So, and most heads are out of the dirt when you find the injury. So a light cleaning with some cotton wool was helpful, and I did actually flush it, but I was able to put cotton wool in its ear to stop the saline and everything going down through its ear, but it did really well. This rather gruesome looking wound as well. This is a very good reason why you need to make sure that the springs work on those hooks that people use to hang buckets and hay nets up, and fix the hook facing the wall, so the other way up to this one. This horse was innocently, I would imagine, bending down to have a drink, and somehow got a bit close and stuck its eye in there, and then did what all horses do and panicked and tore a hole in its eyelid. Did incredibly well. This white stuff coming out of the eye is some ointment I'd stuck underneath the eyelid to help, and it healed very well. I'm sorry I haven't got an after picture of that one. Now, just because a wound is on the foot, please don't change your approach. You'll be amazed how many farriers want to poison the soft tissue on the horse's foot. And it's mainly because to harden up tissue, they're very used to using Stockholm tar and copper sulfate and all sorts of products. But actually, if it's gone deep enough for it to bleed, it's exactly the same as any other tissue that you've got on any other part of the body. And please don't contaminate it or try and harden it off, because you will actually damage the tissues again and you'll get lots of gunk coming out. So wounds on the bottom of the horse's foot, if they've gone through the hoof and are deep enough to bleed badly like this, please treat them like every other wound, and they will heal in time. And speeding up the hardening off process is actually quite difficult. It's going to harden off in all good time, and it'll harden off much quicker if it's kept really, really clean. Now, first aid kit. Again, please remember, I think it's important to have a first aid kit and a treatment kit, and the treatment kit is a cupboard kept well away. Now, you'll I'm sure all say to me, and often people do, that everybody raids the first aid kit when they can't find a bandage, and that is a problem. I totally accept that. But keep it very, very simple. The most important thing, as you can see, is to have something clean that you can stick on a wound and wrap tightly on to stop bleeding, and then you can rush off and find some other things. Hopefully everybody's got a mobile phone or a teenager nearby, so you've got ways of communicating with people. Having a pen and paper is really handy in the first aid kit, because you can make notes about the timings of when things happened. When you managed to get the bleeding stopped, for instance, when you think the wound happened. They're all things that in an emergency always fly by, and you think it really hasn't been very long, when in fact it could have been hours. So well worth keeping those sort of things noted down. And then just keep it very simple, just some scissors to help cut anything to size that you might want to. Clean water I put on there, because if you're going away to an event, You don't necessarily want to rely on water out of a dirty trough. If you can take 20 litres of water in addition to the stuff that the horses need, just in case, that would be great. Hydrogels, and then sterile non-adherent dressing, actually not so essential in the first instance, but a roller gamgee will do that. And, so at least if you've got a roller gamgee that you can cut to size, you can do that. And then any sort of bandage, actually, anything over the surface. Obviously, vet wraps, very well known, but anything over the surface. So don't please put any of your magic gunk in. Wound powders were invented by Satan. Don't use those. And leave your experts behind too, and certainly don't use bute. So hopefully you've picked up a few things. Stop the bleeding, leave the big foreign bodies where they are so we can see what's going on and that you don't create more damage and more bleeding. Don't remove any horses that you think might have a fracture. Get small wounds checked out so we know exactly what's going on, and get the wound clean. The solution to pollution is dilution. Hosing is great. Don't contaminate it by sticking anything in it once you've got it nice and clean, and please treat them gently. I see horses' wounds being treated in a way that nobody would ever treat a wound on themselves. So if you imagine that the wound is on your forearm and what you do to that, I think that's a fairly good thing. And that is all from me, and I look forward to answering any questions that you may have in due course.
Chris, thank you very much. And I loved, and we didn't plan that quote. I don't know who that quote was from at the end of your presentation, but it's a lovely segue into our next webinar in a couple of weeks' time, buying a horse, traps for the unwary. So thank you for the prompt for that. But Chris, I could have listened to you for forever. That was absolutely superb, and already lots of questions coming in. So please do look at, if you're on Facebook, put them in the comments. If you're on Zoom, then use that Q&A. And if you're also on Zoom, do vote other questions. I noticed the most popular question is what to put in your first aid kit. I think you've hopefully covered that one off, but maybe we'll get a few more questions around that. So Chris, thank you. And I was very taken the fact that, you know, pain, and I was always, one of the first things I was taught is actually pain is a good thing. It's the way the body protects itself from further damage. Obviously you don't want unnecessary pain, but actually removing pain can actually have very negative consequences for the horse. So I think that was really interesting, and why we shouldn't be using bute in these type of situations until the vet arrives. So thank you for that, Chris. I know we'll have lots of questions. So now I'm going to return to sharing my screen, and if I've got this right, there we go. We might even go straight to the before I introduce Jon to the second poll question, which is how confident do you feel in managing an equine emergency that requires first aid? Maybe we should have put that question before Chris's talk, because it might have been biased by that. But anyway, just very confident, fairly confident, not very confident, or not at all. So please, if you're on Zoom, as I say, please do take part in that. If you're on Facebook Live, then I'm afraid you can't take part in the polls, but do next time register on Zoom, and you'll be able to take part. So whilst you're doing that, I'm going to introduce you to Jon Phipps, who I mentioned at the beginning, has recently been promoted as our Deputy Chief Field Officer. So one of our 16 field officers, who his day-to-day job is down in the southwest of the country. And Jon will obviously cover that off in his presentation. But as you can see, Jon hasn't always been in the field of animal welfare. And I had, you know, we always, like I did with Chris, I always asked the presenters for a quirky fact. And Jon said to me, "Oh, well, there's nothing. I mean, I have my career and that's it." And then he comes out with these couple of blinders. The fact that when he lived in London, he appeared as an extra in the movie Backbeat, which I have to say I had to look up. And that's apparently is a film looking at the early days of the Beatles in Germany. And then he lived next door to no other than Larry Lamb. And for those of you who don't know, you might remember him as Archie Mitchell in EastEnders, Mick Shipman in Gavin and Stacey, or even in Ted Case in New Tricks. So, you know, next week we'll find out something else about Jon that we didn't know about. But anyway, before I hand the floor over to him, Basil, can you give us the answer to the poll question. And look at that. That's good. It's really good to see, actually. You know, the majority, 2/3, saying that they're fairly confident. That means that you should be able to cope, but we can always learn more. And I think we can certainly, I'm sure everyone who says they're very confident will accept the fact that they can learn more too. So thank you for that. And without further ado, I'm going to hand you over to Jon.
Lovely. I shall just share my screen. Lovely. Well, good evening, folks. Thanks very much, Chris. I'm only with you for a very short time tonight, and I just want to use this time to ask you that when after tonight and when you all go off and start putting together your first aid kits and working out your emergency procedures, I'd also ask you to have a think about the practical details. It's almost the logistics, if you will, of what happens when, sadly, almost inevitably, your horse managed to injure itself when you're not around. So you may be blissfully unaware of the situation unfolding at your yard. You may be at work, back at home. You may be away on holiday with somebody else left in charge. And as field officers for World Horse Welfare, we may very well be the first people on the scene when someone reports your injured horse in the field. So we rock up and have a look and see what's happening. And, oh, yeah, they're right. There you are. Your horse in the field. It's loose in the paddock. It's running around on 3 legs, or it's got a large wound on its body, similar to what Chris has shown us. Now, the first thing we need to do is get hold of an owner as quickly as possible and tell them that the horse is injured. Without an owner to speak to, we have no idea about any details about the horse and its history. We don't know if the horse is already under any treatment, or even if it's handleable and halter broken. And we have no one to make decisions about its treatment and its care. Now, your horse may be used to you walking into its paddock and approaching it, but you'd be very surprised at how many react differently to strangers approaching them, especially if they're injured. And as Chris has said, when they're injured and in pain, they can be very unpredictable and totally different from that normal docile dobbin that you're used to. And it's this very first step where we all too often have a real problem and waste valuable time desperately going around knocking on people's doors, ringing local vets, trying everything we can to find out who actually owns the horse. And I can tell you from experience, there's nothing worse than standing in the field with a badly injured horse. You can't get anywhere near it and you have no idea who owns it. And if I can't find an owner and I decide, right, I'm going to have to get a vet out, the vet can do many wonderful things, but only if they can actually get hold of the horse in the first place. And even if we do catch a horse, without speaking to an owner, we have no idea what they want us to do. How far are we going to go with treatment? Is the horse insured? Who's going to make the decision on what to do? It's a genuinely horrible place for us to be. So my main plea to everyone watching tonight is to think about these things and help us to help you to help your horses. Please make sure you leave contact details somewhere where we can get them. Maybe with a couple of neighbours, not just with one neighbour, as you can guarantee they'll be out shopping at Tesco's when it all kicks off. Maybe leave a laminated card with your phone number pinned to the tack room door or stuck on the gate somewhere, anywhere where we might be likely to find them. And you'll notice I said numbers, the plural. Please leave us some alternative numbers in case we can't reach you. Maybe some friends or family members that can at least make some decisions on your behalf and give us a steer as to what you want us to do. But it's okay, I can hear you all shouting, my horse is microchipped, you can get my details from that. Well, that's great. And assuming using my greatest horsemanship skills, I've caught the injured horse and I've scanned it and found the chip. Too often when we try to get the registered owner details from that, the chip isn't registered, the phone numbers are old and don't work, or the horse has been sold on and the new owners are not on the system. So we're straight back to square one. So please check your details are correct. Go on to the Equine Register website, use their check chipper service to see what's registered on there. If your details are not correct, please contact whoever issued your horse's passport and get these details updated, or create yourself a digital stable on the Equine Register where you can do it yourself. And other things to think about while we're on it. Where are the spare keys to your gate locks? If you're not there and the horse has to go urgently to the vet hospital, how do we get the gates open? Do we have to call the fire brigade to break the locks for us? All of these things are potentially more delays and more stress for your horse. And after tonight, check other things, especially after lockdown where we haven't been going anywhere. No one's been going to shows. Does your horse still load okay? You don't want to suddenly find out that this is now a problem when you're in the middle of an emergency. And if your horse is unhandled, so where I am, there's a lot of horses that are fresh off the moors or off the commons, or maybe it's a youngster. Please have a plan as to where it can be confined for treatment in case of an emergency and make sure it's used to going into that place So the first time you want it to go in there isn't when it's already injured on stress factor 10. And all things like this and sorts of things we've seen in Chris's presentation tonight, we hope never happen to us. But without some thought and preparation, it can turn a serious situation into an absolute nightmare for everybody, especially the horse. And as World Horse Welfare Field Officers, we are more than happy to help in any way we can in situations such as these, but we need you to help us as much as you possibly can as well. Thank you very much.
Jon, thank you. That's some great messages in there and reminders to us all, because obviously the one thing we all want for our animals is for the best care, and we can't always be around. So that's a very, very good reminder to make sure that we're providing that care as best we can all the time. So thank you for that. So now we get to the Q&A session, and brilliant, both panelists have been dead on time, so we've got plenty of time for questions. And I'm delighted to say that Basil asked where everyone was from, and just to give you a flavour, I think we've got well over 20 countries: US, Canada, on that side of the world, South Africa, Egypt and Senegal, right across Europe, Netherlands, France, Germany, Croatia, Sweden, Greece, Czech Republic, Spain, Norway, Lithuania, Finland, Belgium. I can't remember if I said Senegal as well, but I was talking about Africa, South Africa and Egypt. And then, of course, from Cornwall to the Orkney Islands and from Ireland to East Anglia. So you're all very welcome. And thank you so much for all the questions. Chris, we'll kick off. You obviously started off, finished off with what was in the first aid kit, and gave us a really good summary of that. You also mentioned the treatment kit, or the store cupboard. Just give expand a little what should be in the cupboard.
Yeah, so it's really important, again, to remember very carefully about the things you're going to stick in a wound in a cupboard. For a start, there is a reason why when you've opened something, you should throw it away within a month, because if you don't, and it's contaminated, and you actually might be sticking bacteria straight into the wound. So for that reason, tubes are actually much better than pots, and because you can generally keep them cleaner. But pots, if you've opened a pot and you've got grot in them, please don't stick it in the wound. But think very carefully about the necessity to stick something in. Most wounds actually heal despite what we're doing, rather than because of what we're doing. They're going to heal. There aren't a whole load of horses running around with holes in them that haven't healed, even the wild horses. So essentially, there are, to my mind, three very simple bases for treatments. One is gels, which tend to be they're water, lots of water in a gel. They slip away very easily. If you've got something in them, they need applying twice a day. Another one is aqueous creams, and I'm actually really keen on aqueous creams. So any cream that's aqueous based and very light can be quite useful at keeping wounds moist. I tend to steer away from the ointments, which are the greasier preparations, because they can gather quite a lot of dirt, they can seal wounds in, and they can seal things into wounds. So things, at the risk of upsetting people who might own the company, things like Sudocrem look great, and on the intact skin they can do quite good, but in a wound they're really greasy and sticky. So I tend to veer away from those. Now we've got some really good aqueous cream based products that are prescription only, but things like Flamazine, which are often brilliant on wounds. But otherwise I'd stick to a very basic and light antiseptic human product, because I would veer away from them if the wound looks nice and clean, and I would stick to the hydrogels. And then in terms of other things, for wounds, particularly in treatments, the bit that goes against the wound wants to be sterile. So if you can get a wound dressing of some sort, and there are loads available, then stick it on and keep it sterile. Now there are some of them, one that we use quite a bit actually to cover stitches and places that we've stuck needles in that we want to protect, called melanin. Actually, melanin, if it's stuck straight to a wound, when you pull it off, does tear tissue away. It is adherent. So although it looks nice and shiny and looks like it's going to come off, it doesn't always. The more expensive ones, like a leave-in, which some people will have seen, which is more spongy. Those are genuinely not adherent. So something like that. And then after that, the next layer is something absorbent. So it's either gamgee on places that are easy to go to dress, or cotton wool, which cotton wool is particularly good at fitting in round the curves and bends of a horse's leg, and then some form of bandage over the top of that. And it can be crepe bandage plus a vet wrap, or it can be where there are all sorts of bandages you can stick on. So I don't want to be too prescriptive, but if you keep to those principles, then wherever you are in the world, hopefully you'll be able to find something that will fit.
Brilliant. Chris, thank you. John, out of interest, from a World Horse Welfare Field Office perspective, what kind of first aid kit do you carry?
Pretty much exactly what Chris described. We carry some vet wrap, we've got gamgee, sterile pads to put on, scissors. Obviously, we carry things like hoof picks and things like that, because sometimes it can just be a simple stone in a shoe. Water, we've got copious amounts of water in the back of the trucks, and saline solutions and things like that. So yeah, just pretty much what Chris has said, and gels as well. We've got gels, so it's just there, should we need it.
And there's quite a lot of chat going on, actually, John, just picking up on your point about the Central Equine Database and having that up to date. And just there was a reminder, actually, in Scotland, they have a Scott Equine a card system up there, which at the moment I know is free. I think they will start charging for them, which is sort of a card version of the passport, isn't it? And so that it's worth getting that as well, because if you're Scottish based.
Absolutely, yeah. Anything at all that gives us an idea or will identify you and link you to the horse. Yeah, absolutely.
Brilliant. Chris, what should you do if your horse has a nosebleed?
So there are lots of reasons for nosebleeds. If it's a traumatic injury, so if the horse has fallen and bashed its nose, actually, although it'll look quite dramatic. Think of the last time you saw a toddler with a nosebleed. It looks really there's quite a lot of blood, goes quite a long way, and the horse will look as if there's a lot of blood appearing. But just try and keep the horse calm, and generally you'll get covered in blood as it blows its nose to clear it, but it will actually stop bleeding. Most importantly, if you're not sure why it got the bleed, then do speak to the vet, because there are a number of different reasons why horses should have blood coming out of their nose. Some of the ones that you will have seen at competitions, it's probably actually coming from the lungs, and it may be something that's bled from the lungs, or it may be something further up in the head. But with a scope and probably a wash of some sort, we'll be able to work out hopefully where the blood's coming from and avoid it becoming a further problem.
Brilliant. It's a question around foot abscesses. I'll come to you, Chris, first. Any advice on initial treatment of foot abscesses, please, and how often to poultice? You mentioned that, Chris, in your presentation.
Yeah, so again, keep it very simple. I noticed I've been through some of the Q&A, managed to get through a bit of it, and I'll try and cover a few people's questions. The most important thing with the foot abscess is there's enough drainage. This is where there's a sort of counter between the farrier and the vet, and the farriers don't like the fact that we make a hole in the foot, but you've got to make a hole in the foot to let everything out. And trying to do it through a tiny little hole can mean that we keep coming back and coming back and coming back. So making sure there's enough drainage is important. That may involve taking the shoe off. Once you've got it draining, then there are other products available, but the most common one is Animal Intex. Animal Intex is brilliant because it's got boric acid in it, and it draws in the same way as a magnesium sulfate, so Epsom salts could. You could make a similar poultice if you put a whole load of Epsom salts into hot water, soak some gamgee and stuck some plastic over the outside, so some cling film. So you can do that with a poultice. Now, interestingly, I see there's one question about nappies, and there'll be a lot of nappy advocates in the audience, I imagine. Nappies are designed to dry things. That's what they want to do with the baby's bottom, is keep it dry so it doesn't rash. So actually they're designed to draw the water out. And a poultice is actually there to sort of seep the whole thing and keep it moist and draw through the strength of the salt in the poultice. So although nappy's quite easy to put on the bottom of the foot and might be really good as a dry dressing, they're not actually that good as a poultice. So, and then I tend to recommend, I used to recommend changing the poultice every 12 hours, but I tend to recommend every day, and that seems to work fine. But if you're poulticing for more than 2, maybe 3 days, you haven't got enough drainage. If the horse is still sore and you're still getting lots of gunk, you should be able to go to a dry dressing after 2 or 3 days. Otherwise, it probably needs re-seeing by somebody to get the drainage improved. You certainly shouldn't be poulticing for a week, 10 days. That really isn't necessary.
Brilliant, thank you. John,
I was just interested when Chris said earlier that 95% of times when you go to a field and it looks like the horse has broken its leg, it's a hoof abscess, and that's what we find. We've got lots of calls, people saying, "Oh, the horse in the field with a broken leg," particularly this time of year. We'll get there and it will be a hoof abscess. And where we find people struggle is where they haven't got anywhere dry and the fields are absolutely swathed with mud. And then it puts the vet and the farrier in a tricky position, because if they burst it and put a hole in the hoof, how are they going to be able to keep it clean and keep a poultice on? You know, if the poultice is going to constantly come off because it's so wet. And that's why it's really important that people have somewhere dry, either a yard or a stable or somewhere, for situations like that, where they can actually get the horse out, get it nice and clean, and keep a poultice on it for the time they need it.
Yes, that's a real chance, especially at this time of year. Chris, what are the first signs of infection in a small wound?
So yeah, the first sign of infection is somebody who hasn't cleaned their wound properly. There are so many wounds that we would be able to treat really satisfactorily without worrying about infection and thinking that you need to go to get antibiotics. And if you think about it, a lot of us will get wounds on ourselves, little tiny wounds, which will get locally infected, but they don't infect our whole arm, or need us to go to the doctor for antibiotics. So, and that's possible with animals too. So get the wound really clean. But the first thing you'll see might be some sort of pussy-like discharge. But what you do have to remember is that the body will react to foreign bodies, little tiny foreign bodies, in the same way as it'll react to some bacteria. So you may get a pussy-like discharge, which is just associated with the fact that dirt got in the wound. So the most important thing is to be cleaning it twice daily and cleaning away that discharge and pussy material with salt water. But the critical thing about infection, and when you know things are infected and maybe spreading further away from the wound, is pain. Infected wounds are painful, and all of us know that. We've all had things on our hands maybe that have gone infected, and even tiny wounds can be awfully painful. I mean, really, really sore. And so if you're pressing away from the wound, on the outside around the wound, and the horse won't let you anywhere near it because and is reacting as if you're pressing sunburn, you've probably got infection in there. There may be other reasons, but pain is probably the biggest indicator of infection.
Thank you. There's a question there whether the Scott Equine ID cards, the smart cards, are available in England. Unfortunately, they're not at the moment, but we are pushing very hard for a digital solution so we can move on from a paper passport, which is somewhat 20th century. Chris, question around insurance companies. When should you inform your insurance company if your horse has had an injury?
So as soon as their office is open, straight away. The thing about wounds, traumatic injuries like this, is that you're not getting an exclusion on wounds. You might get an exclusion on further damage of a certain area if a specific area is damaged, but essentially you're not going to get an exclusion on traumatic injuries, and they will potentially become fairly expensive, because any amount of bandaging in a horse, once multiplied up, is going to cost you quite a bit of money, and it is expensive. So yeah, as soon as the office opens would be my advice.
Chris, thank you. And it is probably worth noting that actually World Horse Welfare membership, the Champion Plus membership, has an option with additional veterinary fee cover, which covers equine accidental external injury for as many as horses in your care, and that costs just £130 a year. And I think Basil will put a link to that in. But thanks for that, Chris. Next question. Sorry, missed out on that. I knew someone would ask us, and lots of people want the answer. Chris, what's your opinion on purple spray?
Well, I'm gonna cover. I noticed it's purple. I'm going to cover purple spray and wound powders. Firstly, wound powders, please don't use them. Lots of people have them, and again, it goes with that myth on drying up wounds. But generally, the body sees most wound powder as foreign material and foreign bodies, and wants to get rid of it. So don't go for those. And purple spray. The disappointing thing about purple spray is that the original purple spray, which had gentian violet in it, was an antiseptic type spray. There are very few of those antiseptic sprays around anymore, because the gentian violet, if you know it's gentian violet rather than crystal violet, if it stains your fingers and it stays there for weeks. Crystal violet washes out with soap and water and is not nearly as good as an antiseptic. But you may also be mentioning, because they're not quite so purple anymore, they're a little bit green, but the antibiotic sprays that are available as well. And sadly, they just don't get the antibiotic to the right concentration in the wound to do any good. So all they really do is they expose bacteria to antibiotic and give it the opportunity to become resistant. So I'm not really in favor of any of those. Purple sprays, as I say, the crystal violet ones that you can get off the shelf in the local stores, they are antiseptic. They possibly help a bit. But again, actually your twice a day bathing and protecting the wound would be really helpful. And can I just sort of extend to one other question just briefly, because it's sort of relevant to this area. Someone's mentioned flies and how to protect from flies. Everybody can smile, you know the shape of the smile. If you apply some form of fly protection in a smile underneath the wound, but not directly to the wound, you can keep the flies off to a greater or lesser degree. As we know, most flies give 2 fingers to a fly ointment, but without actually putting the stuff in the wound. So don't put it in the wound, but you can certainly put it round the wound, just not over the top where sweat might carry it in.
Yeah, John.
Well, yeah, just talking about purple spray as a field officer, it's one of the things that always frightens the life out of me, really, when I go somewhere and I see a horse covered in purple spray, because I just think, oh crikey, what's that hiding? It's very unlikely a vet would have told them to put that on. So that's not always the case. Sometimes a vet has recommended they put that on after they've treated it, but a lot of the time it does. People use it to thinking it will repair things that really is a vet job. One of the cases I had years ago was a horse that got itself stuck in an upturned hay feeder in the field, and it had managed to pretty much deglove the lower half of its leg from the hock down to its fetlock. So we had a cannon bone exposed and tendons and all the rest of it, and all the person had done is put purple spray all over it and left it. So that was about a week later it was reported and the horse was removed. And they were prosecuted for that, and they thought that was a suitable first aid remedy, was to cover it in purple spray. So yes.
And John, sticking with you, Chris will have a view on this too. If a horse is bleeding, do you prioritize cleaning the wound or putting pressure on to stop the bleeding?
I think well, I don't know. I'll divert to Chris on that. I guess it depends on the extent of the bleeding, does it, Chris? And how fast it's coming out, really.
Yeah. Ooze and drip. I'd get the wound clean. But yeah. if you've got it spraying out, I think you'll find that there's a sort of imperative in you to try and stop it, and I would stop the bleeding. One of the thing the old horsemen always used to say with a foot wound, particularly, is if they started to bleed, they were always delighted because it would flush the wound. And there is some truth in that. The blood coming out will have hopefully carried some of the gunk that was in the wound out with it.
Yeah, no, absolutely. And then sticking with you, Chris, about cleaning the wound. Someone's asked, should you hose the wound directly? She was told, or they would. So yeah, yes, she was told to hose above the wound so the debris would come out, whereas hosing the wound directly could possibly push the debris further in.
So again, I mean, as I said right at the beginning, there's probably no one way that is absolutely right on this, and there's no. I think most people who've had a wound on a horse will appreciate it when I say that we quite often look at a wound and think, well, if I was starting with a wound that I wanted to treat, I wouldn't put it there. They're often in really inconvenient places and a real nuisance to treat. If it's heavily contaminated, you've got mud all over it, then there's a really good argument for not putting the pressure of a hose, and you don't want the hose on too much pressure anyway, directly on it. But generally speaking, we're talking about a running hose that isn't going to be blasting dirt into the wound, but it's just going to keep, with repeated running, cleaning the wound. And on cleaning it, on the sort of twice daily cleaning with the salt water and a bit of cotton wool, I call it a dog lick technique, and because getting rid of the gunk is really important. But rather than just having one bit of cotton wool and giving it a quick wipe, if you just keep with fresh cotton wool wiping and wiping and wiping, like as if you were a dog licking the wound, you'll get it really, really clean very effectively. So I think in most cases we wouldn't worry too much about forcing it into the wound. Don't turn the hose up that strong.
And so someone says, power washers, absolute no-no.
Absolute no-no.
Yeah, fine. Chris, you talked about, obviously, the proximity of, or how close a wound is to a joint. Mary's asked, do you have any advice for assessing the severity of a puncture wound, especially near a joint, and when to call the vet?
So, yeah, I think this is one where I really would get your vet in as part of the team, because it's very, very difficult. That's why I recommended taking them seriously. And so I would call the vet fairly quickly. They may say, or you can offer to send a decent picture, and we may look at where it is and its distance from a joint, say, and say, don't worry about it. Because actually, an awful lot of people will send me pictures every year of something that actually is a graze and isn't a full cut, because they can look similar. But I will want to stick a probe in, maybe even a gloved finger into the wound and explore it. And there's no way I can tell that just from staring at it. So best to give us a shout early on, I would say.
Fine. I love Helena's question. She says, my instructor keeps telling me to pick the scab off my horse's minor wounds. I don't agree. Scabs are part of wound healing. Who is correct?
So I love this one, because most people will remember it's sitting in a maths lesson. It's usually maths at school when they were very small, and they would be scratching away at scabs on their knuckles. Anybody who played properly had scabs on their knuckles. And there are two types of scab. There's the scab on your knuckle that comes off like a trapdoor and always has something gooey underneath that's slightly salty to the taste. Did I say that? And then there's the scabs on your knuckle that are really firmly adhered, and they hurt a bit when you scratch at them, and then they bleed straight away when you get that tiny little bit off the edge of them. Those are the ones that need to stay. So effectively, if you're using that dog lick technique that I talked about, and the scab is just lifting off and coming off, get rid of it all, because those are like bandages that need changing. They've got goo underneath them, and they're dirty. But if you can't get the scab off through fairly vigorous cleaning, then it's fine to leave it, because that's probably clean underneath, and you're absolutely right, is effectively nature's bandage. But some bandages need changing. They don't want to be just left there forever.
Brilliant. John, jump in any of these. A few of these are more sort of Chris directed, but do jump in. Rowan has asked what to do with an eye wound. Swelling has gone down, but it keeps weeping weeks on.
Yeah, so I mean, it'll be the specific wound potentially, and so difficult to advise specifically on this. If the wound was anywhere near the lower lid, it might have affected the drainage of the tears. So you might be getting tear overflow because of that. It might even have damaged the structure in the bottom of the bottom corner of the eye that drains the tears away. So very difficult to say. If there's a bit of what we grandly call blepharospasm, but actually is just blinking, then there's probably discomfort involved there. So I'd get it looked at as well.
I think from a field officer point of view, eyes and injuries near joints are the two absolute 100% you need a vet. If there's any puncture wounds near a joint or anything to do with the eyes, then we'd always recommend just getting a vet straight away to those.
Brilliant. Not really, very quick answer to this one, Chris. How can you tell which flexor tendon, superficial or digital, is sprained in the leg?
With a scanner.
Right, so that's a vet job. Good, thank you. When is it appropriate to use iodine as an antiseptic? Archie's asked that. Chris?
Well, do you know, funnily enough, I'll bring that into one of the other questions I think I spotted, which was talking about whether you can use rainwater. Iodine in most cases well, there's various different types of iodine that you'll get out there. The pure iodine, straight iodine, will stain your fingers, so you know that stuff. And then there's stuff called povidone iodine, which is a slightly altered type of iodine. But again, about 10 mils in half a bucket, so it looks like really quite weak urine, is probably strong enough. But actually, I would go with salt water in this country, but I was thinking about people in other parts of the world that are struggling to get clean water, or even the water out of the tap isn't that guaranteed to be clean. Iodine's a really good water treatment product. So using iodine to a concentration that you'd use to sanitize water, and maybe leaving the water for a second before you use it to clean the wound would be really effective, but very, very dilute. If it looks like tea, you've got it too strong.
Katie's asked what you should do with overreach cuts.
Oh, they're horrid, aren't they? And almost always contaminated, because the foot that's come into the back of the leg has contaminated them. Actually, the immediate, if you've got a bit of chunk of tissue hanging off, then same thing, hose it, get them as clean as possible. We treat them, an awful lot of them, if you've got chunks of tissue hanging off, with casts, because it saves on that repeated bandaging, and they do really, really well under a cast once they're clean. But little nicks and things, same sort of treatment we've mentioned, get them really, really clean, and then bandage them, because they're close to the floor. I know it's real nuisance, and it often means that you have to keep the horse box rested for a bit. But if you get them clean and keep them clean, they'll heal so much quicker, and you won't be struggling with them for weeks and weeks.
Brilliant. I love Sam's question. As a human first aider, is there anything that you would do in humans that is completely wrong to do in horses?
Mouth resuscitation. Chest compressions may be quite difficult. Do you know, having done the human first aid course several times myself, I mean, obviously quite a lot of the techniques you're being taught are quite specific on splinting and things. I don't think I'd be attempting to splint anything, but stabilizing something with a big, heavy, a big, thick, padded bandage will often reassure a horse in the same way as it'll reassure a person. So if a horse has something wobbling around a bit and loose, actually, if you can stabilize it and just put a really nice padded bandage on it while you're waiting for help, you'll be amazed how calming that is for the horse. They seem to benefit from the same sort of placebo effect as we do, and some of that may be because the humans around are happier because it all feels good too. But I don't know what you think, John, but horses do calm down if you get things under control, don't they?
Absolutely, yeah. It's one of the most important things. What you said right at the start is just if you can't handle it and you're going to panic and scream, and which is perfectly natural for some people, they don't like these situations, then really you need to stay away and just let people that can be really calm and soothing. And it's amazing how quickly you can bring an animal down just by lowering your voices, making it nice and calm and reassuring. Yeah, it's really essential.
Brilliant. We're getting over time now, so we'll probably have to sort of start winding up. So a few quick fire questions. If guys, if you can answer them as quickly as possible, that would be great. Where can we buy your hydrogels, Chris?
I think you probably find them. They're online. The two I put up, one's called New Gel, one's called Intrasite. There may be others, but if you look for New Gel or Intrasite, they'll be more expensive on Amazon than elsewhere, but you may have to pay delivery from somewhere. We're very happy to supply them to our clients. Brilliant.
Manuka honey. When's it best to use Manuka honey?
So when your bank balance is fairly full, it does have its place. It's really good if you've got a heavily contaminated wound with lots of crusty filth in there. the difference between the concentrations in it, and I won't go into the detail, can help debride the wound. But once you've got it clean and it's not discharging anymore, actually honey can be too strong for the tissues, so ease off then. So it does have its place, can be very, very good, but don't use it throughout.
And Chris, this is probably one for you as well. Thea's asked, what do you recommend for closed wounds like sprains and strains for first aid? Are magnetic boots any good? Heat massage, arnica creams?
So cold hosing is really good, and just remember with cold hosing that actually 15-20 minutes is plenty of time. You're not trying to sort of keep it cool all the time necessarily. At competitions, it's difficult to have access to cold hosing. So some of those things that you can stick into the freezer, those wraps and things that you can then take in a cool bag, those can be really good for traveling back from competitions with. So I would go with cold as much as anything else. Arnica gel in humans is found to be as effective as ibuprofen gel, but actually causes more reactions. So I haven't seen that much in horses, but arnica gel is probably effective. I'm afraid, and I won't go into it in detail, but magnets aren't effective at all.
Right, okay, fine, brilliant. Maya's asked, is there anything I should or shouldn't do to get less scarring to a wound? Sorry.
Yeah, absolutely. And I look after a lot of show horses, and I know exactly what you have to do to get the least amount of scarring, and that is get wounds impeccably clean. If you can avoid any sort of contamination or with bacteria or foreign bodies and get them really, really clean, you'll be amazed how they heal really well without scars. The bigger ones, particularly if there's missing tissue, you're going to get some form of scarring, I'm afraid. That's the way it works.
Brilliant. Listen, we're coming to the end, and I think we're going to have to draw it to a close. But quick question around eye ointment. Best way to get ointment in the eye, Chris, if required? Right.
So this is one that's going to go on my YouTube channel, and I haven't done it yet. I really apologise, but because I need to do a demonstration. But you need 3 hands, so you need somebody else holding the horse. And with your left hand or your non-dominant hand, if you put your index finger on the upper lid as close to the eyelashes as possible and push in like a doorbell, the eye will retract slightly and your third eyelid will come across. And then with your thumb, you lower down the lower lid, which will create a shelf. And then on the shelf by the third eyelid, so you're not going to jab the ointment into the front of the eye, you can deposit the drop. You won't if you press your own eye, it doesn't hurt, so you won't hurt the horse by doing that, and you'll get it in good and quick.
We look forward to that video. So, and then Jessica's asked, for foot abscesses, once they're clear and there is just a hole left, can you put hoof putty in to stop anything going back in?
Yeah, I found this really difficult because actually it's the real question is, the problem with hoof putty and stuff like that is you're sealing it back up, and potentially if you've still got contamination in there, it'll just set off again. So the answer to that is it depends really, which is very unhelpful, I understand. Generally, dry dress for 5 days to a week after they've dried up, and you should be able to leave it open regardless without any hoof putty or anything. Brilliant.
Chris and Jon, thank you. Now, I didn't warn Chris, but Jon has done one of these webinars before, so hopefully he'll remember. But so I'll come to you first, Jon. I mean, obviously, as ever, we've covered a lot of ground and lots of different situations. What would be your sort of take-home messages be from tonight's discussion?
So 2 really. One is, as I said in my my talk, just think ahead and make sure that if the emergency happens when you're not there, somebody can get hold of you or get hold of somebody quickly to discuss what we're going to do with your injured horse. And the second one is recognize your own limitations and recognize that first aid is first aid, and when you need to call a vet, and not to overstretch yourself and not to just leave it and think, right, that's it, I fixed it, I don't need a vet. You know, understand when you got to make that call.
Brilliant. And Chris, what are your final thoughts?
So very much along with John, I think bring us into the team, bring the vets into the team. You know, even if it's just over the phone, really helpful. Stop the bleeding, because that's the urgency, and then cleanliness, clean, and don't contaminate. That's it.
Yes, it's been a while since I've heard the solution to pollution is dilution, but it's only a very powerful phrase, isn't it? Listen, thank you. I start every of these webinars talking about World Horse Welfare a little bit, and I finish all of them just apologising to all of you for so many good questions, and we've only managed to get through a fraction of them. But thank you so much for your engagement tonight. It's been great to have you with us. To John and to Chris, thank you. That was outstanding. Really good. So many positive messages coming through, so we really appreciate your time with us tonight. Don't forget that if you've got ideas for future webinars, then do please send them through to us at education@worldhorsewelfare.org. In a fortnight's time, we'll be back with our next webinar, Buying a Horse, Traps for the Unwary, and that's on St. Patrick's Day, March the 17th. And that will be almost 2 weeks then, only 2 weeks until the clocks go back and the days get longer. As you can see, I'm a bit infatuated about the days getting longer and be able to hopefully get out, and we can get out on our horses and get out and about the country. Those days hopefully aren't too far around the corner. But thank you so much for joining us this evening. Look after yourselves and look forward to seeing you in a fortnight.